Well, I want to start by thanking everyone for coming to our session here on prevention. It looks like we've got a good crowd, though we may have lost a few to health system strengthening and care and treatment, the topic du jour. I want to remind everyone in the room that we're being webcast, so we'll try to keep this discussive and the Q&A process as comfortable and free-flowing as possible, but you will have to speak into a microphone every time. So I remind our panelists of that as well. Unfortunately, we only have 4 microphones for 9 panelists, so we'll have to be good at sharing on our end here. um, and hopefully we can keep each other aware of that if your fellow discussant happens to not turn theirs on. This is the session on prevention and the primarily focused on the prevention chapter of the recent IOM report. So if you want to be doing health system strengthening or care and treatment, now is your moment to make an exit. This session will be about 75 minutes. It looks like we're starting about 5 minutes late, but we'll still try and get out of here on time so that everybody can have their coffee break and get necessary caffeine for the next one of these. We are fortunate to be joined by an incredible panel here and a really robust panel. I'll just go down the line to introduce everyone. The first member here is Kate Wetton. She's a member of the committee and with Duke University. Second, we have Jen Cates, who's also a member of the committee, or former member of the committee, I should say, now that the committee has completed its work. And she's with Kaiser Family Foundation. Next, we have Ms. Carolyn Ryan, and she's with the Office of the Global AIDS Coordinator. And then Ms. Nina Hayson, my apologies, also with the Office of the Global AIDS Coordinator. We have Ms. Dorothy Maroki, I say that correctly? Thank you. With FHI Roads in Tanzania. She's made probably the longest trip or Kenya. Oh, my apologies here. Then we have Mr. Daniel Wolf from the Open Society Foundation, Mr. Chris Breyer from Johns Hopkins University, and Mr. Michael Toll from Bipai, Tanzania. So perhaps it's a toss-up for who made the longest trip to get here. The structure of our session here today will be, we'll have a few moments for some short presentations by our panelists, or short opening remarks by our panelists. They've been asked to keep it brief to the extent that that's possible, and so that we'll have as much time as possible for Q&A or discussion. Q&A we encourage the audience to ask questions during Q&A and hopefully participate in what will be a robust discussion, but also encourage the panelists to participate and ask questions of each other in this so that we can get maximum use of our time here. We'll start with our 2 representatives from OGAC who will have each about 5 minutes to present their responses to the chapter, and then about 3 minutes per panelist of the remaining panelists. We have a staff member in the back, Maggie Hawthorne, who has the famous yellow and red cards. So she'll hold up a yellow card when you are at your time and a red card when you've gone over your time. So the red card is the signal to wrap up. And our hope, actually, the first thing we'll do is I'm going to give everybody about 5 minutes to review in your packet. Hopefully you got one, and if not, there are more just outside this room. In tab D, you'll see it'll be called Prevention Main Messages, and that's just a brief 3-page summary of the main conclusions and the one recommendation contained within the prevention chapter. So if you haven't gotten a chance to look at it before now, we'll give everybody just a couple moments to review it so that we are all on the same page. And then let's say 3 minutes, I'll turn it over to Ms. Ryan or Ms. Hanson, whoever wants to go first. So everybody, you have about 3 minutes of silent reading time.